Are your knees or fingers getting stiff, painful, or hard to move? You might think it's just part of getting older. But if so, you could be missing the signs of a bigger issue. It might not just be age, it could be osteoarthritis, the most common joint problem in the world. The good news? With the right steps, you can slow it down, protect your joints, and stay active for years. I'm here to talk about a common but often overlooked condition, osteoarthritis. It's not just about creaky knees and stiff fingers. It's about understanding what's happening to our joints and how we can step in to make a difference. So let's get into it. First things first, what exactly is osteoarthritis? Picture this. Inside your joints are these amazing things called cartilage, kind of like a cushion that lets your bones glide past each other smoothly. Now imagine that cushion starting to wear thin. That's the essence of osteoarthritis. It's a breakdown of this protective cartilage. And as it wears away, it exposes the bone underneath, leading to pain, stiffness, and a reduced ability to move. Osteoarthritis isn't just confined to one part of the body. It can affect any joint, but some areas are more prone to it than others. We're talking about the knees, hips, hands, and spine. These are the places where the wear and tear of daily living really show up. Now you're asking, why does this happen? Well, think of your joints like a well-used pair of shoes. They might look fine at first, but over time they start to show signs of wear. That's what happens with osteoarthritis. It develops over time due to the natural wear and tear on your joints. But it's not just about time. There are certain things that can speed up this process. First, let's talk about age. As we get older, our bodies go through a lot of wear and tear, and the cartilage in our joints isn't exempt. It's like an old pair of shoes that have seen better days. Older people are at a higher risk because as we age, our cartilage starts to deteriorate more quickly. Next, joint overuse or injury. Just as you wouldn't keep running in shoes with holes in them, putting too much stress on injured or already damaged joints can accelerate osteoarthritis. Think about someone who has had a knee injury and then goes on to do a lot of high-impact exercise without fully recovering. The knee is not happy. Then there's obesity. Extra weight puts added pressure on your joints, especially in the knees and hips. It's like trying to move in shoes that are 2 sizes too small. All that pressure can lead to faster cartilage breakdown. Genetics also play a role. Some people are predisposed to osteoarthritis, meaning it runs in their family. It's like if your shoes were genetically programmed to fall apart after a few months. But wait, there's more. Bone deformities can also contribute. If your bones aren't lined up correctly or have abnormal shapes, it can cause uneven wear and tear on the joints. It's like wearing shoes that are shaped weirdly. They might look cool, but they're not good for your joints. Now, did you know that gender plays a part in osteoarthritis? Women are more likely to develop it, especially after age 50. It's like a lottery that only women are playing and they don't even want a prize. So now that we understand what causes osteoarthritis, let's talk about what you can do if you find yourself in this situation. First on the list, stay active. Exercise is not just about keeping a healthy body, it's about keeping healthy joints. But here's the catch, you need to choose the right type of exercise. Low-impact activities like swimming, cycling, yoga, and brisk walking are your best friends. They keep your joints moving without putting too much stress on them. No. 2. Maintain a healthy weight. This is not just about fitting into your favorite pair of jeans, it's about reducing the load on your joints. Every little bit counts. Even losing 5% of your body weight can make a big difference. Next, protect your joints. It's time to treat your joints like the valuable assets they are. Avoid repetitive motions that put a lot of stress on your joints, and remember, good posture is always in fashion. Practice proper lifting techniques and watch your joints will thank you. 4. Tackle pain and inflammation. When osteoarthritis flares up, your joints might feel like they're on fire. To soothe the pain and inflammation, apply warm compresses. It's like a cozy blanket for your joints. And here's another tip. Use cold packs after activity to reduce swelling. It's like an ice pack soothing a bumped knee. Over-the-counter anti-inflammatory medicines under doctor supervision can also help manage the pain. 5. Physiotherapy. A physiotherapist is like a personal trainer for your joints. They can guide you with exercises to strengthen the muscles around your joints and improve your range of motion. It's like having a custom-made plan for your joints. If you need additional support, no, 6, medical support. When osteoarthritis acts like a bull in a china shop, breaking through all your self-care efforts, it's time to call in the cavalry doctors. They have tools like joint injections, braces, or in more severe cases, surgery to help you. It's like calling for backup when the situation gets tough. Now, you might be wondering, can osteoarthritis be cured? Unfortunately, the answer is not yet. But here's the positive spin. By making the right lifestyle changes, following the treatments your healthcare team recommends, and protecting your joints, you can slow its progression, reduce pain, and maintain mobility. It's like being a coach for your joints, guiding them towards better health. Bottom line, osteoarthritis might be common, but it's not a surrender. It's not something you just live with and let take over your life. It's a challenge you meet head-on. It's about being proactive, making smart choices, and advocating for your own well-being. You see, every ache and stiffness doesn't mean you have osteoarthritis. But if left ignored, those aches and stiffness could be a sign of something more serious. So don't ignore your body's whispers. Learn to listen. Understand what might be causing the discomfort. Is it the wrong pair of shoes, an old injury that needs attention, or something else entirely? Make informed choices to protect your joints. Don't fall into the trap of inactivity. Keep moving. Find activities that you enjoy and that keep your joints healthy. Whether it's swimming, dancing, gardening, or just taking regular walks, movement is medicine for your body and soul. Don't let osteoarthritis define you. You're more than your diagnosis. You're a warrior, a survivor, a champion of your own well-being. Remember, knowledge is power. Understanding your condition is the first step to taking control. Stay curious, stay engaged, and stay hopeful. Educate yourself about osteoarthritis, ask questions, and become your own health advocate. There's strength in knowledge and even more strength in sharing it. Talk to your friends, family, and community about osteoarthritis. Create a network of support and understanding. Together, you can raise awareness and encourage others to take care of their joints. It's time to stand tall, to move with grace, and to live life on your terms. Thank you for joining me on this journey of discovery and empowerment. Until next time, stay strong, stay active, and stay hopeful. Remember, you're not just living with osteoarthritis, you're thriving in spite of it. You're not defined by your diagnosis. You're defined by your resilience and your spirit.